Hello, my name is Frida Espinosa Cárdenas. I'm a doctoral student at the School of Human Evolution and Social Change. I'm grateful to be here today and to the co-authors of this presentation. Latin American mothers in this country continue to be underinsured or uninsured, mainly due to the types of essential work that women do and the lack of protections offered to them. Women who qualify for access but lack permanent or legal status rely on the Federal Emergency Services Program, which grants temporary access for labor and delivery only, and in other circumstances for emergency mental health services. COVID-19 has restricted services even further for this population. Parting from social determinants of health in 2015, Dr. Haiti Castañeda and her colleagues made a call to look beyond the traits that often are used to explain immigrant health outcomes, such as individual behavior and level of acculturation. She concludes that examining structural factors fosters a social determinants approach to immigrant health, and this in turn compels public health practitioners to support policy and programmatic interventions, rather than just individual ones. Transnational Determinants of Health responds and pushes the conversation to say that social determinants go beyond one place and time, saying, yes, let's look at structural barriers, but don't forget how home country conditions as well as the migration experience itself also contributes to health outcomes. Hence my research question: how can perinatal experiences of Mexican and Guatemalan mothers who gave birth during the COVID-19 pandemic inform programs and policies supportive of transnational families? As a feminist scholar activist, it is vital for me to recognize my positionality in relation to the participants and the research process. Unlike many of the study participants, I was educated in this country but had the privilege to study and work in Mexico, making me a native Spanish speaker and a bilingual professional. I am also formally undocumented and an immigrant rights advocate, which allows me to build rapport quickly with this population and pick up on subtleties about living in Arizona without legal status. I was a prospective doctoral student at the time of this study and also the translator of the survey implemented. So in the summer of 2021, I interviewed 35 Spanish-speaking women. The participants, I interviewed them over the phone using the Qualtrics survey described previously. I analyzed the text of 10 open-ended questions and identified domains and themes. In order to identify structural barriers specific to this population, I implemented an intersectional lens that allowed me to recognize the various forms of marginalization that immigrant or transnational birthing people faced during the COVID pandemic. All participants gave birth between May and December 2020 at the same birthing facility. 11 Guatemalan and 24 Mexican mothers participated. I personally was not expecting such a high number of Guatemalan women, but this speaks to the national, ethnic, and linguistic diversity of the Latinx community, specifically immigrant communities in Phoenix. Although we did not systematically collect this information, and it's not recommended to do so generally, a few participants did report being undocumented or having a mixed status family, meaning that within one same unit, family members could be undocumented, have temporary status, or be U.S. citizens. These three groups of findings were identified in the previous presentation. I will focus on the intersecting findings that describe the challenges of transnational families. Here I highlight 4 intersectional findings. The fear of being alone during a birth due to COVID restrictions was rampant amongst the study participants. In the first example, however, the fear this mother faced was amplified because of the language barrier she knew she would face if she was left alone. My husband asked if the C-section was necessary. He told them she wants to have a normal birth. I asked him again, "You are going in the OR with me, right? I do not speak English or Spanish." My husband told me I can't go in, but I told him I won't go in without you. My husband told them again, "She doesn't speak Spanish." Finally, they said, "Okay, you can come in." "I speak, Mom. This language does not exist here, only in Guatemala." The second example was the fear of a parent contracting COVID due to the lack of support systems, by knowing but amplified by knowing the older child does not have insurance due to being foreign born, and the financial implications of that, especially at a time when the family income was significantly reduced. I was more worried than anything that my partner would get sick because it's just him and me, and that my daughters would get infected. My oldest daughter does not have insurance because she was born in Mexico, and when I take her to the doctor, we always have to pay. My partner's work hours decrease, so that worried us. Here, on the third example, I illustrate how themes intersect to amplify financial hardships, especially if the mother is undocumented or an undocumented worker, or does not have access to care after leaving the hospital where she delivered her baby. The third example, it reads, "My other breast had nothing. It was dry. It's been a week and I went to the doctor, but they didn't check my breast. They told me that if I wanted to be checked, that I had to go to the ER. They told me it can be my heart because my arm and my chest hurt, and that I should go to the ER, but I told them I don't have health insurance." And the fourth example exemplifies the intersection of financial concerns with food insecurity and being an undocumented parent. It helped a lot when they would come to the apartments to serve breakfast. Without documents, it is very difficult to make enough even for food. I get stressed when I see the amount of food in the fridge becoming less, or when it's time to pay the rent. This is just a tiny sample of the study's findings, demonstrating the challenges and fears that transnational women face during the COVID pandemic. The implications are many. This study demonstrates transnational determinants of health should inform services within the birthing facilities, but also outside, especially within the postpartum phase. And there's an urgent need to provide adequate, culturally sustaining, language accessible COVID-19 health information, and specifically about its transmission in utero or through breast milk. This study also demonstrates the need to extend medical coverage for a year after birth. SB 1272 would allow this extension. I don't have clarity if SB 1272 would also extend emergency access, but this is something that I will investigate further. Lastly, although the study highlights challenges and deficiencies among immigrant communities, community cultural wealth and assets should always inform programs and services that cater to transnational families. Thank you very much for your attention today.